The ministry implements the syndromic management approach that I spoke about, the syndromic management approach for the identification and treatment of STI cases in all public health facilities in the country. The private sector is also expected to comply and follow national standards in terms of management of STIs. I also want to highlight that we have also institutionalized routine syphilis testing for all pregnant women. If a pregnant woman comes to a health facility, we do routinely offer syphilis testing because that's very important in preventing mother-to-child transmission of syphilis. So we have reached more than 90% of pregnant women have accessed syphilis testing and treatment. So I would like to speak about the STI hotspots in the country and which are the at-risk populations and shed more light in terms of statistics for 2019. As I mentioned earlier, vaginal discharge syndrome, these are the most common STIs that were reported in 2019. And these were followed by the urethral discharge syndrome. Urethral discharge syndrome appears in men, like what was explained earlier on. So in 2019, we reported 81,000 cases of vaginal discharge syndrome compared to around 80,000 in the previous year. So those are the numbers of reported cases of vaginal discharge syndrome. But you find that based on a study which we conducted, etiological study that we conducted recently, we realized that about half of these vaginal discharge syndrome cases, there were no pathogens, there were no agents that we identified. Then we realized that another 20%, 1 out of 5 women, had the candida infection that I spoke about. And then the other 50% had the real pathogens that cause sexually transmitted infections. So now speaking about these urethral discharge syndromes, so I'm going to speak about each of these different syndromes because there are some differences in terms of statistics. The urethral discharge syndrome in men we received reports of about 65,000 cases in 2019. So there was a slight increase of about 10,000 cases from the previous year. And this is an indication that we still have high-risk sexual practices that need to be addressed. And this could be likely due to some shortages of condoms that we experienced in 2018 and 2019. And even this year, we've had challenges in terms of distribution of condoms because of the lockdown measures due to COVID. So, but we have sort of resuscitated, and we hope that there will be improvement in terms of supplies and distribution of condoms. So in terms of, so for both urethral and vaginal discharges recorded in 2018 and 2019, the age band that recorded the highest figures for both of these syndromes was the 25 to 49 year age band, 25 to 49 years. And in terms of where these cases were coming from, most of these cases were coming from Midlands province and Mashonaland West provinces, those two provinces. So moving on to genital ulcer disease. Genital ulcer disease, this is an important syndrome in the sense that when there's an ulcer, where there's a break in the skin within the genital area, the risk of acquiring HIV is higher. So these are the conditions that increase the risk of individuals acquiring HIV. So we noted that there was a reduction of genital ulcer disease cases from 35,000 in 2016 to 32,000 cases in 2019. Most of these were reported among the 25 to 49 year age group, and more males than females. So for genital ulcers, it's more males that are affected than females. Midlands province had contributed the majority of genital ulcer disease, followed by Mashonaland West province. So the districts that have highest burden of genital ulcers, these are those in mining areas, and therefore we are trying to really do targeted approach in these hotspots to ensure that we increase availability and access to condoms and efficacious medicines for the management of STIs. So I'd like to move on to another condition which is called Ophthalmia Neonatorum, which affects babies who are born to mothers with STIs, with syphilis. So we reported in 2019 1,500 cases of Ophthalmia Neonatorum cases. And the numbers have sort of remained more or less the same in the past couple of years. So with a slight reduction. There is a slight reduction from 2013 to 2019. So in 2019, I just want to highlight also that STI data showed that about 1 out of every 10 STI case, they were repeat cases. So these are high-risk groups of people who end up coming back for services for recurrent STI cases. And therefore, these are the people that we are targeting in terms of health education, counseling, and use of adoption of safe sexual behavior, because these are high-risk groups. From our data of 2019, we also observed that 1 out of 6 individuals had a positive HIV status. That is about 15%. Studies have shown that STIs increase the risk of HIV infection, especially those that are of ulcerative nature, like when there's an ulcer, there's broken skin, like what I alluded to earlier. So what we have seen is in areas where there are small-scale mining activities with artisanal miners, these are the same areas that have got high numbers of STI cases and HIV cases as well. These are the same areas that are frequented by female sex workers. And due to the current economic hardships and all that, you find that female sex workers take huge risks with even condomless sex. And this creates a high-risk sexual encounter. So these are some of the challenges that we are experiencing. And we do have programs that I'm going to speak about to address these populations. So the areas that are mostly frequented by sex workers include Midlands, Mashonaland West province, even Mashonaland Central provinces as well. We've also seen the large cities like Harare, Bulawayo, Gweru. These are also hotspots for STI transmission because of the lot of activities that happen and transactional sex that happens as well. So I would like to summarize by saying the at-risk populations for STIs include the female sex workers and their clients. I think that's an important aspect which we need to highlight. Clients of sex workers, these are some people that are in established marriage unions, but they also engage in sexual transactional sex and expose others, many significant others, in HIV and STIs. The long-distance truck drivers, the artisanal miners, so these are the groups that we are targeting. And men having sex with men. These are also another key population that we're targeting. So I would like to move further and speak slightly differently in terms of what are the successes that we have achieved within the STI prevention and treatment program in the country. We do have STI policies and guidelines that are updated regularly based on international standards and guidelines. We've integrated STIs, and particularly syphilis, into HIV service delivery, where we are targeting, as a country, we are committed to the dual elimination of syphilis and mother-to-child transmission of HIV, also known as EMTCT. So as a country, we've made those commitments where these two conditions are being managed. And we have a validation process that is going on with WHO and country stakeholders to really push hard and eliminate both syphilis and mother-to-child transmission of EMTCT. HIV testing is routinely offered to all STI cases. So when an STI case presents to a health facility, they are offered HIV test. And the testing rates are very high. And all our facilities provide HIV testing services. The program also has developed clearly targeted interventions targeting these at-risk populations and communities in these hotspot areas where facilities reach out. They conduct outreach programs to go out and offer comprehensive services, not only STIs, but HIV, STIs, and other SRH services to really provide comprehensive services to these key affected at-risk populations. Our healthcare workers are also well capacitated through training in management of STI cases. So we have pre-training, pre-service training, and in-service training as well to update, to refresh our healthcare workers on latest guidance or guidelines in STI management. We also have surveillance for STIs, surveillance where we regularly study and see what's going on in terms of what are the causative agents of STIs. Is our treatment still effective? You know, we also collect monthly statistics based on cases that are reported at health facilities. And therefore, we are able to monitor the trends over time in the last 15 years, in the last 10 years, in the last year, what is happening and how to intervene appropriately. So these are the successes of our program. I also want to highlight at this point some of the challenges that we are experiencing as a program, and we would wish the honorables to help us to address. And many of these challenges are hinged on resources. You find that the program is not well resourced compared to the other programs that we have, and a very small amount of money, less than 5%, comes from the fiscus. So it's something that we need to mobilize resources. We have inadequate medicines to treat STIs. So sometimes you find you have diagnosed someone with an STI. If the medicines are not there, it becomes challenging to give someone a prescription to go and buy because they may not afford to buy the medicine. So we do have medicines, yes, but they are not adequate. In terms of laboratory services, we do have test kits for the various STIs that we have, particularly syphilis test kits. But we would need more for us to really reach full coverage to desired targets that we've set for ourselves. We have challenges in terms of contact tracing, especially for female sex workers, because some of them, they can't even trace their own clients. So that is a challenging area that we experience. Also, we've observed that there's low condom use, particularly among long-standing relationships. Even among female sex workers with regular clients, they also tend to relax and not use protection. Sometimes also because of the economic hardships, they find themselves engaging in high-risk sexual behaviors. Last but not least, we're seeing also low-risk perceptions, especially among the young people. So this is an area where we are also targeting the young people to also be able to be aware of the STIs, and we are seeking to provide those services. So I just want to highlight that as ministry, we are committed to the STI program, and no one shall be left behind. We cater for everyone, including the babies, the children, the adolescents, the young people, the adults, the elderly. Our services are friendly, and we're trying our best to make sure that we reach very high coverage.